You are watching the Doctalk show. In our future story today,
bad odor can come from a number of different things. One thing, if the teeth are not clean. If there's food stuck between the teeth, if the teeth have holes and the food sticks in there, it sort of can even become smelly from overstaying in a hole in the tooth. Or if someone has gum problems and there are these little deposits between the teeth or under the gum, that one can make a distinctive odor, frankly. So that's some of the things, is just to get your teeth cleaned and keep them clean. Another important thing is to keep the tongue clean. It's amazing how the top part of the tongue has bacteria that produce these odors. So how do you clean them? You can just brush the top of the tongue, or they even make special little tools called tongue scrapers, and you can take those and clean off the top part of your tongue. That will help. So really the main things, any holes that you have, get them fixed. If the teeth need cleaning, get them clean, and then clean them on a regular basis. Another thing to realize is most of us, when we wake up in the morning, the saliva has not been flowing during the night. Most of us probably have that odor in the morning. And so you can eat something, or you can brush your teeth and your tongue. You can rinse with a mouthwash from time to time. Many of us, if we haven't been eating for a while, that odor will tend to come back. Some people say that when you fast, the odor goes away. That one I can't prove. I'm not sure about that. But then there's another unrelated to dental and very common cause, maybe even one of the most common cause of that bad odor is it's a medical cause, from the sinuses. If our sinuses sort of sinuses produce secretions, but some maybe more than others, and if that sort of goes back into your throat, then that odor can come from the sinuses. You may even, if you have a lot of that, you may need to see your ear, nose, and throat doctor. And some other people have, it's not so common, other medical conditions that may cause odor, but probably the most common are the dental and the sinuses.
you are watching the Doctalk show.
Welcome back. We are discussing a dental issue that is very embarrassing to many people. This is bad breath. Yes, when the breath from your mouth is undesirable to other people, it's causing some sort of stigma. People don't want to associate with you because of what is coming out of your mouth, how it smells. That's what we call bad breath. So I want to understand what exactly causes this bad breath with our team of dentists, Dr. Nelson and Dr. Deborah, to help us understand what are the causes of bad breath. Dr. Nelson, bad breath per se, what causes it? Why would someone have, despite brushing their teeth, they continue having bad breath? What could be the cause?
Thank you, Dr. Darius. Just before we go to the causes, it should be noted that actually bad breath, or what we call halitosis, is the third commonest reason, or third commonest dental entity, disease entity, as per se, as to why patients usually come to the dentist. It has quite a number of causes, but they can be categorically, broadly classified into two. There are those causes that originate from the mouth. The problem is in the mouth itself, within the mouth itself. And there we look at the structures, or the tissues, or the elements of the mouth. The hard tissues, like we've already seen, the teeth, and then the gums. The problem could be with the teeth, problem could be with the gums. When you look at the teeth, you find that you could be having dental caries, dental decay. Your teeth are rotting, they are getting rotten, they are decaying. They could give you bad breath. And when you look at the other structures in the gum, like the mucous membranes that's covering the tongue and the gum, they could also have a problem. Say possibly you're not brushing your tongue well, it's retaining a lot of plaque and bacteria, it will definitely give you bad breath.
So dental caries, how exactly would they cause this bad breath?
To just explain about the dental caries, in simple terms, let's imagine these are pits.
The teeth?
The cavities, the holes, the pits in the teeth. Now these act like bins. Now just imagine a dust bin. And what you eat gets trapped inside those holes. Inside the caries, inside the cavities. Now the food, of course, when there are pits and food trapped there, normal brushing will not take it out. It is trapped inside. So just like any food dumped anywhere, it will ferment, and what comes out is not really appealing.
It's that bad odor
Yes,
from
so the
fermentation.
cavities act like trapping areas for food, which afterwards ferments. And like any rubbish pit somewhere, it will release an odor that is not good. So the same thing applies to the mouth. If you have holes, there will be like dustbins for dirt, food,
Those residue
yes, to
particles,
pack in, and
you can't easily remove them by
yeah,
brushing.
and until you sort the hole, until you work on the tooth so that no more food packs inside there. Yeah.
Okay, so apart from, so we have understood dental caries, yes, that's how they can cause the bad breath because of food getting trapped in the holes. Could there be any other cause apart from the dental caries?
Yeah, we talked of gum disease and
Gum disease?
disease affecting the jawbone and the membranes that are supporting the tooth. You find that bacteria usually accumulates in those tissues that are diseased, and that bacteria, it's been found that it can have the ability to release what we call volatile sulfur compounds, and it's those compounds that cause actually the bad breath.
Volatile sulfur.
Compounds.
Then
Those are
what are those?
fumes.
That come out. Just
Coming
like a
from the
perfume.
bacteria.
Yeah, the
Yes.
bacteria have the ability to produce those fumes.
Okay, so they're producing substances that
Give
come
you
out
the
as air and they make
Exactly.
the air smell bad.
yeah.
Okay, so the gum disease and dental caries would cause that.
Yeah, and the
Okay.
other thing, there's what we call tonsil stones. The tonsils are the pads at the end of the throat, in the mouth. When you open your mouth wide, there are those pads that are at the extreme that when you touch, you actually feel like choking. Yes. Now, those pads, sometimes if there is a accumulation of stones, it's called calculus. Calculus is like hard, just like how you see hard stuff in the gum area around the teeth. Even those pads sometimes can accumulate those stones, and those rough surfaces can what? Retain food.
Are they actually real stones?
It's minerals.
They are stones in a sense that they have calcium
Yeah.
incorporated in them, and then they mineralize, they get hard.
They get hard.
So they are
Yeah.
stones in that
So
sense.
Stone is like the simple term. Yeah, it's like,
deposits of minerals.
yes. So those minerals are rough and they become retaining surfaces for dirt, for foods, because remember that is the channel to the inside of the body. So not all food will just pass. Some gets trapped there, it ferments and releases a foul smell. Then also the tongue. Most times when we brush, we forget to brush the tongue.
We should always
You
brush
know,
the tongue.
hurriedly, yes, we should always brush the tongue last. When you're done with everything else, brushing, always remember to brush the tongue. And these days, toothbrushes are coming with tongue scrapers. If you notice, some toothbrushes have tongue scrapers on the behind.
Just at the back of the
At the back.
cleaning
So
surface.
after brushing well, the bristles themselves might not clean the tongue so well because it's really rough. So you just turn the brush and scrape the tongue. Scrape the tongue.
Does it remove, why should you brush the tongue?
The tongue is rough. If you notice, it has papilla. They are more like hairs, projections. And those projections, what? Become retention surfaces for food. And we have different types of tongues. Some people have what we call geographical tongues. Some people have fissured tongues, those tongues that you just see like a map when they have grooves. Now those grooves
are kind of different.
Yes.
Okay.
Now those grooves can also become retention surfaces for food and dirt. That's why it's important to always clean the tongue last.
So most people forget to brush the tongue. So it may be a simple act as brushing the tongue that will correct the
Yes.
bad breath.
Yeah.
Because you can brush the teeth, you don't have caries, but if you forget to brush the tongue, it would cause the bad breath.
Bad breath, yeah.
Okay. So that is part about the oral hygiene. Okay. They kind of forget, they don't do it very well. Either they don't brush the teeth well or they forget to brush
The tongue.
That would cause a bad breath. I think after the break, we shall understand more about some of these conditions that result. The problem is not in the mouth, the problem is somewhere else. But probably
body.
the end product or some disease process results in production of the bad breath. So after the break, we shall understand more about what other causes of the bad breath and how we can treat some of these conditions.
You are watching the Doctalk Show.